A very good morning to all. Today we will start with the new topic, that is continuation of the breast disorder. Under that, the breast cyst. From the name we can understand that the breast cyst, that is a condition in which there is a formation of the cyst, that is small tumor like structure that is formed inside the breast. Okay. Here this normal structure, a diagram of the breast. In that the lobules will be there, areolas that is surrounding the nipples in the center, that is the nipple is there, then the ducts will there. These ducts will help to carry out the milk, and if there is a blockage of these ducts, then the breast disorders can be developed. And these are the lymphatic supplies, that is the lymph nodes, that is from the base breast to the underarms. And this is a small structure that is abnormally formed, a cyst which is inside the breast. So a breast cyst, it can be defined as a formation of fluid filled mass in the breast. So there will be a formation, means there is a fluid filled mass. The mass which is a cyst that is filled with the fluids in the breast. The shape, it may be a filling of the round or oval mass with the different edges. So the breast cyst, it can be a round or oval shape. Next, if the patients are we fill, then the cyst, it feels like a grape-like structure. Means it is not a shape or fixed, but it is a grape-like structure or water-filled balloon, because the definition we have seen that it's a fluid-filled mass. So the filling will be grape-like structure and water-filled balloon. And this condition, that is a breast cyst, is very common in the women of 30 to 40 years of the age. Okay? So from this, remember the definition of the breast cyst. It can be defined the formation of fluid filled mass in the breast. Breast cysts don't require the treatment unless a cyst it is very larger and painful or comfortable uncomfortable. Okay? So the breasts, which is very small, which does not causing any pain or uncomfort to a patient, they will relieve by themselves. But some cases, if this is they are very larger, they are causing pain, then it needs to be treated. And in that cases, draining the fluid from the breasts can ease the symptoms. Okay, the cyst that is containing a fluids. So the fluids can be drained, and we can relieve the symptoms of the patients that are of pain and uncomfort. Next, that is the types or classification of the breast cyst. So there are mainly three types of the breast cyst, or three classification of the breast. It is simple cyst, complex, and complicated. Okay. So first, that is a simple cyst. A simple cyst, they are having a smooth, thin, and regularly shaped walls, and they are completely filled with the fluids. The sound waves, that is with the help of ultrasound, they sent out by the ultrasound test, they pass the right through them and indicating there are no any solid areas. So that's no any solid, but they are only filled with the some fruits, and they are always benign. Okay? Benign and malignant you already know under the cancer. Okay, so simple cyst, smooth, thin, regularly shaped walls, and they are filled with the fluids. Complexes, they are opposites of the simple. They are irregular, scallop borders, thick walls, and there are some evidences of the solid areas or debris in the fluids. So here the presence of the debris, that is a dead tissues and cells, and a solid area in the tissues. This solid area, they echo back the sound waves from the ultrasound. Okay? So this solids area, they will not able to pass the sound throughout the complete coverage of the breast. A complex cyst is sometimes aspirated, okay, or drain with a fine needle aspiration, that is removing by the aspiration, and drain, that is a liquid that is removed by the drainage procedure with the fine needle, so that the fluid inside it can be tested. If the blood or any unusual cells they are present, then further testing may be needed to rule out the breast cancer, because the cyst may be of the cancer cyst. So complexes, they are irregular, scallop borders, thick walls, and there are evidences of the solid areas and debris in the fluids. And these solids areas are not able to keep the sounds waves from the ultrasounds. And last, that is a complicated cyst. Complicated cysts, they are in between the simple cyst and the complex cyst. Although they share most of the features of the simple cyst, that are of fluid that is filled inside the cyst, and they tend to have some debris. They are the features of the complexes. So there are presence of the debris inside the cyst, and echo back some of the ultrasound waves, and they are not able to echo back some of the waves. They don't have the thick wall or obvious solid components that a complex cyst has been. Okay, so that's a physical structure of the complicated cyst. Okay, so remember three types, that is simple cyst, complex cyst, and complicated cyst. In the simple, that is nothing but it is a fluid field. In the complex, there are chances of the presence of the debris, some dead tissues, and complicated. They are in between the simple and the complex cyst. Next, the sign and symptoms of the breast cyst. A smooth, easily movable, round or oval lump with a distinct edges. Okay? So this will be identified with the breast examination either by the self or by the doctors. It will be a smooth, that is easily movable. The shape will be round or oval. There is small lump-like structure with the distinct edges can be felt, and which typically through not always indicating it's a benign. Okay. There may be a chances that the nipple discharge, that is discharge from the nipple, that may be very clear, yellow, straw color or dark brown colors. These are the variable colors of breast nipple discharge can be there. Next, that is a feeling of the pain. A breast pain or tenderness in the area of the breast lump. Next, increase in the lump size, and the breast will become tender just before the menstruation. Decrease in the breast lump size and resolution of other symptoms after the menstruation period has been over. And this before and after menstruation, that is normal, but there is sometimes due to the hormonal this will appear. Sign and symptoms, that is filling of the easily round or oval lump, the discharge nipple with variable colors, pain in the breast or tenderness in the around area of the lumps, increase the breast lump size before the menstruation and decrease the lump size after the menstruation. Next are the causes of the breast cysts. Okay, the breast cysts, they are mostly made up of the, as we know that the breast, they are made up of the lobules, that is a milk producing glands, and the ductals, which we have seen in the diagram, that the ducts, they are the tubes that carry the milk to the nipple. The milk glands, they are surrounded by the fibrous supposed tissue and fat, and that are known as the breast tissues. Okay? So the glands, the surrounding parts of the glands, that's known as the tissues, and these tissues, they gives breast their size and the shape. And sometimes the milk glands can fill up with the fluids, and these are nothing but it is a breast cyst. Okay? Remember that this is not a breast milk secretion. It is other fluid that is filled inside the ductus, and that will form a breast cyst. Overgrowth of gland and connective tissues. If there are, due to some reasons, the glands will be overly growthed or there is overgrowth of the connective tissue, then they can lead to formation of the cyst. There are two cysts, that is micro and macro. Micro, that is a small, and macro, that is a big. Micro cysts, they are too small. It can be seen only under the test. The patients or doctors, they cannot feel or they cannot examine. And macrocysts, they are large enough that they can be felt under the breast examination. Next, the hormones, they are also leads to a breast cyst in that excess level of the estrogen. It can lead to formation of the cyst. And after the menopause, that is cessation of the menstruation, estrogen levels that gets stop or fall. So cysts usually stop forming, but the women who are taking hormonal replacement therapy, under that they are taking the estrogen, so they can lead through a development of the cyst. Mhm. Next, the diagnosis of the breast cyst. How we can diagnose a breast cyst? That first, that is, at the breast clinic, the patient, they must have a breast examination. Okay, so first there is a complete history and physical examination of the breast needs to be done. They may also have a mammogram or ultrasound scan. This mammography or ultrasound scan, they are helps to detect the cyst using a sound waves to produce an image of the breast. Okay. So as we have seen in the previous slides, that the some cysts, they are not able to pass out the sound waves, so sound waves, they are used to produce the image of the breast or both. Ultrasounds can help to find out if the lump, that is solid or fluid swells, such as benign cyst or debris is there, that it can be found out by the ultrasounds. If the women, they are under the 40s, they are more likely to have ultrasound than the mammographic testing. Younger woman's breast tissue, it can be dense, which can make the X-ray image, it is very less clear, so normal changes or benign conditions can be harder to identify with the X-ray. And for some women under the 40, mammograph may still be needed to complete the assessments. So mammograph, X-ray examination, USG examination, and breast examination, that's very important for the diagnosis of the breast cyst. And if the lump can be easily felt, and if there are any microcyst is there, specialists may put a fine needle into it and draw off the fluids to confirm that it is a fluid filled cyst or not, and also to rule out the cancerous breast or not. So these are the diagnosis of the breast cyst. Okay. Here in the diagram you can see that this is a fluid filled lump. So with this ultrasound examination and with this the needle, the fluids, it can be aspirated from the breast. This is same diagram. This is above. This is ultrasound examination, and under that guidance, a needle is inserted inside the breast, inside that lump, and the drainage of the fluids can be possible. Next, treatment of the breast cyst. So treatment, that is vary and that depends upon the types of the cyst and the patient's age. If the patients, they do not have a breast cyst or cyst, they will not usually need any treatment or follow-up. Okay? This is for the those patients, those who develop the breast cyst before the menstruation and who resolves the breast cyst after the menstruation. So these patients, they do not require any treatment. Most cysts, they go away by themselves and they are nothing to worry about. So most of the cysts that develops due to the hormonal imbalance, they will go away or they will relieve by themselves. If the cyst is very larger and thus causing a discomfort or pain to a patient, then a specialist may draw off the fluids that is under the ultrasound guidance using a fine needle and the syringes. And sometimes this is done under the ultrasound to help to find the cyst. The fluids can vary in the color and it can ranges from the clear to very dark. And if the fluids is bloodstream, then it will be sent to a laboratory for further testing or for confirmation of any further diagnosis. So treatment, that is, for some patients they don't require any treatment, it will resolve by themselves. If the cyst is, and for larger cysts it is fluids that is removed with the help of syringe and the needle, and the fluid is collected for the further diagnosis. That is all about the breast cyst. This is a diagram of the multi-directional aspiration. Okay, as in the diagram we can see that this cyst that has been aspirated with the help of the syringe and needle and the fluids that has been collected, and this is for the diagnostic purpose of the test. Once the fluid is removed with the help of syringe and needle, the cyst usually disappears, and they might feel some discomfort as the fluid is being drawn off, and the area it may be bluish and tender for some days afterwards. If so, taking of pain relief like the paracetamol, that is, or non-steroidal anti-inflammatory drugs, they can help to relieve the symptoms. The breast cyst, it can come back or there may develop a new cyst. So recurrence of the breast cyst is very common. The treatment for the cyst is usually a same for each and every time. Okay? So at the same time, the treatment, there will be first examination of the breast cyst with the help of mammograph, breast self-examination, ultrasounds, and if there are fluids filled, then it will be removed with the help of syringes and needle. Next, paracetamol and non-steroidal anti-inflammatory drugs will be given. Next, surgery. Okay. Surgery to remove a breast cyst is necessary, that is only in the unusual circumstances. It may be considered if the uncomfortable breast cyst it recurs month after month, means it is recurring every month to a patient, that is a cyst is developing every month, or if they are containing blood stained fluids or shows other worrisome signs, when some other discomforts or very severe signs, the presence of the bloods in the fluids that is drawn by the syringe and needle, then a surgical removal of the breast cyst is done. Otherwise, it will be treated with the help of the other treatments as we have discussed. So that is all about the breast cyst. Uh, we will quickly revise about the breast cyst. First, we have seen the definitions, that is a fluid filled lump is present inside the breast. Hmm? So there's a diagram, that is lobule, nipple, areola, ducts, cyst, and lymph nodes can be defined as a formation of fluids filled mass in the breast. Round or oval shape, bifilling, it will be grape-like or water-filled balloon, will be common in the women of 30 to 40 years. They does not require any treatments, will undergo relief by themselves. Types: simple, complex, and complicated. Signs symptoms: filling of the lump, next nipple discharge of variable color, pain or tenderness in the breast, increase lump size before menstruation, and decrease size after the menstruation. Causes, that is because of the lobules and ducts, overgrowth of the glands and connective tissues, micro, that is too small, macro, large enough to be felt, excess level of estrogen, and the women who are taking hormonal replacement therapy. Diagnosis, mammograph, ultrasound, X-ray examination, and removal of the fluids by a needle to confirm a fluid-filled cyst. Okay, this is a diagram of the removal of the fluids under the ultrasound. Treatment, that is a simple cyst don't require any treatments, will relieve by themselves. Next, if that is a fluid fill, then the fluid is removed by needle and syringe with ultrasound. If it is bloodstream, then needs to be further testing. Okay, this is a diagram of multidirectional aspiration of the fluid. Okay, once the fluid is removed, the cyst they usually disappear, and after that it will become bruised and tender. So paracetamol will be given. Recurrence of the braces is very common, but the treatment will be same for each and every time. And surgery of the removal of the cyst will be in unusual circumstances, that is a severe or worrisome signs of the braces, presence of the blood inside the fluids. So that is all about the breast cyst.